Thank you.
Good afternoon. First, I wanted to say thank you for inviting me to present here at the TEDNet in Athens. It's a real honor and a privilege. A few years ago, a patient came into my clinic. She was having a lot of difficulty walking, despite the fact that she was using a walker. She didn't engage with anybody when she was walking in. She held her head down. It was hard to see her face. She had a very difficult time opening up her eyes. When you listened to her talk, her speech was slurred, and it was very difficult to understand. And when you looked at her, it almost seemed as though she was under the influence of some kind of drug or under the influence of alcohol. And clearly, she was in need of some kind of intervention. When I sat down and talked with her, I found out that she was here because she had degenerative arthritis of her hip. She had been given steroid treatments for a different medical condition, and that had caused this arthritis to develop. She had been to many other orthopedic specialists, and they had all told her that she needed to have a total hip replacement. But that she was too young, and that there's nothing really that they could do at this point in time. So they just gave her a prescription for medication and told her to come back either when she was in more pain or when she was older. She had come to Emory in specific because she knew that we had non-operative sports medicine physicians there. And she was hoping that we would be able to offer her a different type of a treatment modality. And we were able to do that. Over the next couple of months, we were able to get her on a different kind of treatment, which culminated in her receiving regenerative therapy with PRP and BMAC. By her follow-up visit, you would see that she was a completely different person. She was smiling. She was able to walk without any assistance. She was actually funny and engaging. And when I saw her, I realized that that was the first time I had ever seen her smile. In the entire months that we had been treating her, she had never had this kind of a disposition. Something was radically different. When I sat down and talked with her, she told me that her pain was completely gone. She was now able to get up and walk, go for walks when she wanted to, go to the grocery store. She was able to go to her doctor's appointments. She was able to have her life back. She said that BMAC and PRP had saved and changed her life. I want to take the next couple of minutes to talk to you about this innovative treatment that clearly you can see can change lives, but also I think is going to change the way that sports medicine is viewed and practiced over the next few years. When people hear about sports medicine, the first thing that they think about are the elite athletes. But as a previous patient let us know, sports medicine is not just for the elite athlete, it's for the everyday person. As a sports medicine physician, it's my goal with every patient to get them back to their level of function that they had before as quickly and as safely as possible. When I think about that, it is something that always helps us to understand what the true goal of a sports medicine is. If a patient has a recreational activity or is a professional athlete, it doesn't really matter. The big thing is that we're trying to get them back to their function as quickly as possible. The concept of life being motion and motion being life is an integral philosophy to the practice of sports medicine. With that, we understand that you have to be able to get motion back when you have a life and life back when you have motion. Now, before the advent of PRP and BMAC, there were a number of sports medicine problems that we did not have a very good treatment for. These were usually problems that had an issue with incomplete or failed healing. These were chronic problems like tennis elbow, plantar fasciitis, Achilles tendonitis, and degenerative arthritis of the new onset. We also had issues with moderate to severe arthritis, as well as times when you had damage to tissues and muscles and tendons where there was loss of tissue or there was extensive scarring. The issue here was a little bit different than previous in that the problem was that there was damage more extensive than would be able to be treated conservatively, but we still did not have a good surgical intervention. With the advent of PRP and BMAC therapy, we now can treat these patients effectively and efficiently. The key thing here is that when we are looking at getting BMAC or PRP, and BMAC is not new to medicine. They have been being used by cardiothoracic surgeons, general surgeons, and oral surgeons for many years. They use them in instances when you have concerns about whether or not there's going to be effective healing in their complex surgical cases. The innovation here is when you've taken a proven medical treatment out of the operating room and brought it into the sports medicine clinic. The way we do that with PRP is that we draw about 30 to 60 cc's of blood from the arm, we put it into a centrifuge, and then we spin it down to separate the platelets from plasma, the white blood cells, and the red blood cells. Once you've done that separation and you've taken off the plasma, the white blood cells, and the red blood cells, the thing that you are left with is PRP, platelet-rich plasma. The process with BMAC is about the same. The big difference is you take bone marrow instead of blood. The bone marrow is harvested usually from the posterior iliac crest. And you take about 60 to 180 cc's of bone marrow, put it in the centrifuge again, you spin it down, separating the unwanted marrow portions from the stem cells. Once you've taken off those unwanted marrow portions and you're left with a bone marrow aspirate concentrate, which is BMAC. It contains stem cells as well as platelets. Well, when I talked to you guys about doing the BMAC therapy, I saw some people look at me kind of crazily saying, aspirating bone marrow from the hip, that should be painful. It's not. At Emory, we use ultrasound guidance to get the needle down to the cortex, as the video showed, and get the entire harvest tract anesthetized. And once we've done that, the whole procedure is usually pain-free. Once we've harvested the PRP and we have harvested the BMAC and it's been processed, we then inject it into the treatment site. Again, at Emory, we use the ultrasound guidance to guide the needle, as the video is showing, to a specific spot and then inject the treatment there. We do that for two reasons. One, it makes the treatment less painful, and two, it ensures that we can get the treatment into the right area. So, when I first heard about PRP and BMAC, I thought, yeah, this is too good to be true. Here is a treatment that is taking a patient's blood, their own blood products, and then we're using that in the office to treat a bunch of problems that we've never been able to treat well before. The procedure is painless and it works 100% of the time. Yeah, I don't believe in unicorns. So I said I had to go back and find out how PRP and BMAC really work. PRP and BMAC are autologous biological solutions. What does that mean? It means that the same patient who is being treated is the patient who is giving you the product. So there's no risk of infection or anything like that. The key to the BMAC and PRP process is the concentrating of the platelets and the stem cells. Typically, you concentrate them to more than 5 to 6 times what the normal levels would be. And in concentrating the stem cells in PRP, what happens is you shift the amount of time that is spent in a particular portion of the normal healing cascade. You get more time in the proliferation phase and the remodeling phase. So, is it too good to be true? There's a treatment that you can take the patient's own blood or blood products, inject it, and use it to treat a lot of problems that are common and that have had a lot of difficulty, or given patients a lot of difficulty and physicians a lot of difficulty with treating. It's painless and it can be done very quickly. Yeah, I think it is true. It's a dark horse that's rising. Second patient. A few months after my wonderful success with that first patient, another patient comes in, and this was a gentleman who had degenerative arthritis of his knee. He had been to other orthopedists and had failed conservative therapy, and he was trying to put off trying to have that knee replacement for as long as possible. So he came asking for regenerative therapy. His arthritis was moderate, not as bad as the first lady that we talked about, but not as good as some of the other patients that we had treated in the past. When we came in, we went through the normal protocol, we did the normal things, he ended up having the regenerative therapy, and he failed. He didn't get any relief from the injection. And we were left wondering, what did we do wrong? And I think that this case points out one of the key issues or problems that are confronting the regenerative therapy right now as it relates to sports medicine. We don't know where and how to most effectively do this treatment. Right now, we're just beginning to get the sports medicine protocols in place. We're getting some consensus as to when to treat, how to treat, who to treat, what types of cells to use, what systems will give us those appropriate cells. And we're getting better at answering those questions and going in better directions. Right now, regenerative therapy is giving us more questions than there are answers, but we're going in the right direction. It's stimulating appropriate thought. So, third patient. We were in the quarterfinals of the high school championships for football in the state of Georgia. And midway in through the match, one of our players, our star player, goes down with an ankle injury. This ankle injury turned out to not be a normal ankle injury, but a high ankle sprain. And a high ankle sprain is significant because usually this is something that will cause either the end of a season, but most definitely would have caused the end of our run to try and repeat as state champions. We decided, let's do PRP. We did PRP and injected the damaged ligament, and within a week, he was ready to go play again. We decided not to have him play that week because the team that we're playing in the semifinals was one that we should be able to beat easily, so we would save him for the finals, and we would be champions again. We lost the semifinals. But had we won, he would have been ready to play. With PRP, we took an injury that should have taken 4 to 6 weeks to get better and shortened that time to 2 weeks. Amazing. But back to my previous patient that didn't work. Why didn't it work? We still have that question out there. And I think the reason behind that was that he had a significant inflammatory component to his arthritis. And there are newer studies and some consensus that's coming out that having that increased inflammation or inflammatory component somehow counteracts or interacts with the type of regenerative therapy that we're doing in sports medicine. To the extent that there are newer products now that allow us to manipulate the amount of white blood cells, versus red blood cells that we have included in the mixture that we're using. And while these concepts are the new and innovative things within a new and innovative process, we still don't know where this is going to lead ultimately, but it's a good start. What we do know, though, is that regenerative therapy is here to stay. It is offering patients, whether they be elite athletes or just ordinary people, real treatments for real chronic conditions that really impact their lives on a day-to-day basis. It's changing lives, and I think it's changing the way that sports medicine is viewed and the way that sports medicine will be practiced in the years to come. I leave you with this question. Regenerative therapy, is it a game changer in sports medicine? Absolutely. Thank you.